Canberra, for instance, is supposed to have over 200 different cultural communities.
I'm really lucky to be a part of quite a few communities within Canberra, and each of the community that I identify with has faced several barriers in accessing healthcare.
This is where we need to work in such a way that we're able to satisfy the cultural needs.
I'm a woman of colour, also a temporary resident in Australia. I have some health conditions, and in Canberra, we're such an intersectional community, and it feels that the services are not yet catering to those intersectional needs.
We do face systemic racism when we encounter health systems, or the health system is not equipped to meet our needs.
The system works in a very powerful way, right? Like there are very fixed pathways.
The system is huge, complex, but at the same time, if you have enough information, you can know the right track to go through when you need it.
I think the reason that I became an advocate is because I wanted to improve my own healthcare experiences. So I'd often found navigating health systems really complex, a little bit intimidating, and I felt myself not very empowered, but also participate in a lot of structural change for other people as well, because a lot of people share experiences that are similar to me. So yeah.
What made me become an advocate is some of the gaps that I noticed in terms of healthcare provision, specifically for multicultural mental health.
With the multicultural communities, they certainly need a voice to be heard. And certainly a lot of the communities, they actually do not know how to access the system, but they have nowhere to seek information.
Representation of this cohort is really important because it's often the most neglected one.
Well, I've, over the years, learned that if you're in the community, you've got to share your knowledge and also to assist each other.
There were lots of things that I hadn't really actually understood. And so I know that I can't be the only one. And so in terms of going back to my community, for example, and making sure that the women that I'm across and are close to me are understanding some of the challenges and some of the, I guess, pathways in terms of healthcare.
I often worry about the people who perhaps don't have that support and who are having to do that individual advocacy with those additional barriers.
There are various barriers that keep people from multicultural backgrounds from accessing health services.
You feel a bit daunted to approach the system because you don't know what it is all about. It's totally different. It's not just the language, it's just the whole system which can make you feel daunted.
One of the issues we have with receiving care is, I think, systems that really aren't equipped to understand or deal with a multicultural experience or to assist people whose first language isn't English. Because a lot of the work around self-advocacy presupposes almost that the onus is on the patient or the consumer to be able to articulate their needs.
I really try and push for a culturally sensitive framework around healthcare and around service provision, because I think that's the only way that we can address the needs of everyone in the community.
There's an expectation that a health professional or doctor is always right and that you just do what the doctor says. And this, as we know, often doesn't lead to good outcomes for consumers. There's a bit of a long journey, like a cultural journey, to break out of that mold.
When issues about my cultural identity aren't really understood in a health context, I feel that impedes on my capacity to get good health care.
Most patients already feel that power imbalance, but people from culturally and linguistically diverse backgrounds feel it particularly more so.
As soon as you talk about doctors in many homes, I know, they get very scared.
The advice we give to the community is whenever we have information sessions, we advise them to attend. And we always, for example, link up with healthcare consumers to run some information sessions. And also, when we run the sessions, we actually interpret the message in the language that they understand.
So my advice would be to really be curious and ask questions, especially when you go and visit your GP, for example, because there's a lot of services that are available that people just don't know about that could make a big difference.
What I would recommend is look for a support person, someone who understands the health system, another consumer representative or a family member.
Seek help if you can.
The best way to do is to help them and empower them, because if they can understand what the system is all about and they can then make informed decisions.
So you encourage them to go, and if they kind of find some excuses and all to try to overcome their objections and try to say, okay, this is it. If you're worried about this, this is the solution. If you're worried about this, this is the solution. So just let's do it.
We actually advocate that talk to the health, SCT Health or the health services to set up some sort of a communication link and community engagement program.
The community is here with you, and we have so many wonderful healthcare advocates and disability advocates as well. Really find your strength in the community.
Sometimes talking to them, giving them some good advice, and they feel so good. They always like me when I talk to them about if they are not happy. I said, no, there is somebody up there who's going to help you out. Don't dishearten yourself. Little things like that.
Individuals whom we are giving care to need to know about what is happening in the community, what is happening to other people who have similar difficulties as they have, and how they have overcome it, and how they can overcome it.
I feel like there's an opportunity to have more open discussions with key people in the community. So, in the multicultural space, there's always elders and leaders in the community, and that could be an opportunity to provide more information and to try and break down those barriers and to alleviate, and to address some of the stigma.
We need the health services to have what we call a community liaison person or a community connector, what we call it.
I'm a big advocate of the need to really train health professionals and really commit to continuing education for health professionals in the needs of multicultural communities and the particular barriers and issues that they face.
It starts with respect. It starts with trust. It starts with understanding.
There's got to be a commitment to educate oneself and really dismantle some of these systemic barriers to people from multicultural communities.